a comprehensive guide on how to properly use an AED.
Oh no, someone has fainted. Somebody help.
Don't panic, I'm the emergency hero. Let me try.
The emergency hero is here. That's great.
First, carefully confirm that the immediate scene is entirely safe. Personal protection is in place. Sir, can you hear me? Sir? Sir, can you hear me? The patient is unconscious and not breathing. It looks like cardiac arrest has occurred. Hello, could you please call emergency services and guide the medical staff to the scene?
Okay, leave it to me.
Hello, is this 120?
Please go get the AED.
Okay.
Compression position, the midpoint between the nipples. Place the heel of one hand at the midpoint between the nipples, then place your other hand on top of the first, with your fingers lifted. Lean your upper body forward so that your shoulders are directly above your hands. Keep your arms straight and use the weight of your upper body to press down vertically by 5 to 6 centimeters. Compress at a rate of about twice per second and keep your hands in constant contact with the chest. Allow the chest to fully recoil before each subsequent compression. After 30 compressions, get ready to begin rescue breaths. Check the patient's mouth for any foreign objects and remove them if present. Place one hand on the patient's forehead to tilt their head back and use the other hand to lift the chin so it is perpendicular to the ground, opening the airway. Lift the chin, pinch the patient's nose, cover their mouth with yours, and give 2 breaths.
The AED has been brought back. Is there anything else I can help with?
Press the green power button, then just follow the voice prompts. Carefully remove the electrode pads and firmly apply each of them one by one to the patient's exposed bare chest area. Special reminder, if there is chest hair where the pads will be placed, it needs to be shaved off first. If the patient is wet, dry them off first. If the patient is wearing a necklace or has a medication patch, it's best to remove them. If the patient has a pacemaker, keep the electrode pads at least 2.5 centimeters away from it. If the patient is a child or has chest injuries, the electrode pads should be placed in the center of the chest and the center of the back. Analyzing, do not touch the patient. Everyone step back, do not touch the patient, and listen to the analysis. A shock is now advised. Please do not touch the patient. Now, press the flashing shock button to deliver treatment. Defibrillation complete. Please perform CPR on the patient. Continue CPR after the shock. After 2 minutes, the AED will automatically prompt an analysis of the patient's heart rhythm. Be sure not to turn off the AED. Follow its instructions until emergency doctors arrive on the scene.
Hey, the doctor is here.
Doctor, we have been performing chest compressions on the patient and use the AED to defibrillate once.
All right, we'll take over from here. The patient is unresponsive with no breathing or pulse. Begin chest compressions. Pulse found. Transport to hospital now.
Time is life. Learn CPR and how to use an AED to save a life.